Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you're just joining us, we're talking to Express Care's Dr. Jitka Lom about lower back pain. Is something 80% of people experience at some point in their lifetime. Let's check out some of our viewer questions now. Doc, recently I've had pain whenever I sit, bend, and twist. Could I have pulled a muscle? If so, how can I treat it? That's from Daniel from Sinahanya.
Absolutely. Definitely sounds like it, especially it sounds like when you're moving, there's more discomfort. You could try, like we were mentioning, the anti-inflammatories, taking them regularly, 800 milligrams of ibuprofen 4 times a day if you're not allergic. Doing your stretches, ice packs, hot packs. Sometimes going to the chiropractor can be very helpful for alignment. And we mentioned posture earlier too, to make sure that you're trying to sit properly, sleep properly, lift properly, do everything to keep your spine in alignment, which it means straight.
Okay, now we've also got a question from Amanda from Agania, and I know this from experience. My pregnancy has taken a toll on my lower back. Is there any way to alleviate that pain?
Yes, it's very difficult, isn't it? Because in pregnancy, suddenly you're carrying 30 extra pounds on your abdomen, sometimes more. And that puts a lot of strain. So ladies, prior to getting pregnant, make sure that you have a good core. Make sure that you have good, strong abdominal muscles. But even still, that extra weight can really strain your back. So trying to limit the time that you spend on your feet is important. Trying not to wear very high heels because that will put additional pressure on your back. You can take Tylenol safely in pregnancy, and doing your stretches. Yoga is extremely helpful for this. Again, careful lifting techniques. Those were all the prevention ideas that I have.
Okay, and from Simon from Jigo, what is a herniated disc and what are some symptoms to look out for?
Great question. So we talked about the vertebrae of the spine, the bones being stacked upon each other. In between those bones, we have a shock absorber that's called the disc. It's kind of a gelatinous, spongy kind of disc that sits in between those hard solid bones. So it absorbs shock so the bones don't bump onto each other. But what can happen sometimes is that if the bones do bump very hard, or if there's some sort of pressure or trauma, that little disc can inch out a little bit and start pushing on some of the nerves that run out from the spinal cord, the spinal nerves, and then there can be what's called a pinched nerve, and the disc is pushing on it, and then you get shocking pain radiating down, let's say your leg, causing a lot of pain and sometimes weakness. So we call that a slipped disc. And as much as possible, we try to avoid surgery, but sometimes it's necessary for that.
Okay. Question from John from Agate. What are congenital bone conditions that lead to low back pain?
Oh, well, I think the word congenital means inborn. What is something that you're born with that might cause low back pain? I think the most common one that we are all familiar with is scoliosis in children. They can be born with a crooked spine. Sometimes nutritional deficiencies can also do that, or injuries at a very young age. But basically, if the spine is not straight, there will not be good alignment, and over time with wear and tear, there will be some low back pain developing. Sometimes people also will have a misshapen bone just from the way they're made, and that can also cause trouble. So it's important to have children checked, especially if they're suffering from low back pain, because that would not be a normal thing for children to have that.
Okay, one last question comes from Faith from Assen. Is it true that kidney problems are associated with lower back pain?
Yes, they are, particularly if you have kidney stones or a urinary tract infection. Sometimes you can have an infection in your bladder that travels all the way up to your kidneys, and you'll feel pain in the flank. You may be experiencing it as back pain. So if you're having back pain along with any urinary symptoms, then please see your doctor to have it checked.
Okay, well, thank you, Dr. Lom, as usual, for all your wonderful medical advice. Next week, Dr. Lom will return, and you don't want to miss it. She'll be talking about healthcare costs and how you can save money. If you have a question for Dr. Lom, of course, you can always send us questions on KUAM.com or on our Facebook page.